Hi, I'm Nurse Carol. After 30 years caring for women just like you, I want to share something I wish every woman over 50 knew. So pour yourself a cup of tea, get comfortable, and let's talk. Just the two of us. This morning when you went to the bathroom, did you happen to look? I know, it's not something we're ever taught to pay attention to. Not by our doctors, not in school, not by our mothers. But in all my years of nursing, I learned something quite remarkable. Your urine is like a little free health check, one your body hands you quietly every single day. Just by looking at the color, you can get a gentle hint about whether you're drinking enough water, how your liver and kidneys are doing, and sometimes an early sign that simply means it's time to see a doctor. Stay with me right to the end, because there's one color that looks perfectly healthy, even clean, that so many people get completely wrong. And there's another that means don't wait until morning. Before we go through the colors one by one, let me tell you why this matters even more once we pass 50. As the years go by, our kidneys naturally slow down just a little. Our sense of thirst grows quieter, so we don't always feel it when we're running low on water. And many of us are now taking a medication or two or a daily supplement that can change what we see in the bowl. All of that means these little signals become more useful to us, not less. Learning to read them is one of the kindest, simplest things you can do for yourself at this stage of life. So let's begin, and we'll start with the one that surprises everyone. So many of us believe the clearer the urine, the better. Clear means clean. Clean means healthy, doesn't it? I understand completely why we think that. But in medicine, completely clear, like plain water, can actually be a quiet little warning. Picture making a pot of soup. If you pour in far too much water, the soup turns thin and watery and loses all its flavor. Our bodies are a little like that. When your urine is completely clear and you're going to the bathroom very often, 8, 9, 10 times a day, it can mean your body is being watered down too much. The important minerals in your blood, especially sodium, can drop too low. And sodium isn't just the salt in your shaker, it's what keeps the balance of water in and around every single cell. When it falls too far, it can bring on headaches, dizziness, nausea, and a deep, heavy tiredness. Now, please hear me. I'm not telling you to drink less and go about thirsty. Not at all. I'm simply saying that more water should mean the right amount, not drinking until it runs clear as tap water. And if your urine is always clear, even when you're not drinking much, that's worth gently mentioning to your doctor, because occasionally it points to something worth checking. Now, the color to actually aim for. Pale yellow. Like watered down lemonade or fresh straw. Not clear, not dark. A soft, pale gold. Doctors will tell you this is the sweet spot for someone who is well and drinking enough. That gentle color comes from a natural pigment your body makes as it recycles its old red blood cells. And when your kidneys are working nicely, it comes out exactly this shade. So when you look down and see pale yellow, give a little nod. That's your body saying, today, I'm all right. You've had enough water. My liver is working. My kidneys are doing their job. To keep it there, the rule is simple. Sip water steadily through the day. Somewhere around 6 to 8 glasses, and a little more if it's hot or you've been active. And don't wait until you feel thirsty. Here's something important I mentioned before, and it's worth repeating. After about 45 or 50, our sense of thirst grows quieter. By the time we truly feel it, we're often already behind. So drink by the clock, not by thirst. Now, before we get to the colors that concern us, let me put your mind at ease about one you may already have seen. A bright, almost neon yellow. Startling, isn't it? The very first time you notice it, you might think something is terribly wrong. But this one is almost always completely harmless. It usually comes from a vitamin, especially the B vitamins in a multivitamin or a B complex. Your body simply takes what it needs and passes along the rest. And that little bit of extra gives the urine that vivid, glowing color. So if you've taken your vitamins that morning, that bright yellow is nothing to fear. It's just the surplus, leaving your body the way it should. Now let's move to the colors that begin to whisper, "Pay attention." Dark yellow, like strong tea or deep amber. This is the clearest way your body says, "I need more water." When you're a little dry, your kidneys go into a saving mode and hold water back, so the urine comes out darker and more concentrated. First thing in the morning, it's perfectly normal to be a touch darker because you've gone all night without a drink. But if it stays dark all day, even after you've had your water, take a closer look. And here's something to know. Dark urine isn't always just thirst. If it comes with a yellow tinge to your skin or to the whites of your eyes, or a dull ache under your ribs on the right side, and it stays dark even though you're drinking plenty, that can be a sign your liver or gallbladder needs some attention. That's not something to sit and worry over alone at home. It's simply a reason to ask your doctor for a straightforward liver check. Next, the color that frightens people the most, pink or red. But before you let yourself worry, ask one question first. What did I eat? Because some foods can turn your urine pink or red quite harmlessly for a day or so. Beets are the classic culprit. Blackberries, rhubarb, a good helping of berries, even certain medications. If you've had any of those and you see pink, it usually settles within a day or two. But if it isn't food and it isn't a medication, then we do have to take it seriously, because that can be blood in the urine. Now, most of the time, the cause is something manageable, a urinary infection, which is common in women, often with burning or urgency, or a kidney or bladder stone, which usually comes with real pain in the back or the side. But I have to be honest with you about one thing, because that's what a good nurse does. Sometimes blood appears with no pain at all and no other symptom, just a passing tinge of pink that comes and goes. And that, strangely, is the one you must not brush aside, because it's something your doctor truly needs to look at. So the rule here is simple, and it's kind. Pink or red that isn't from food, get it checked that same day. Blood in the urine is never a "let's wait and see." Now, orange. It's different from dark yellow. It leans clearly toward orange, like carrot juice or a ripe tangerine. The most common reason is completely harmless. Plenty of carrots, pumpkin, or other rich orange foods, and certain medications. But if orange lingers for several days without any of those foods or medicines, especially alongside yellowing skin or eyes, or pain in the upper right belly, that too can point toward the liver or the bile ducts, and it deserves a doctor's visit rather than a wait. Then there's blue or green. This one is rare, and I know it looks alarming, but the usual cause is quite harmless. A dye found in some medical tests or in certain imported supplements, which clears on its own within a day or two. Occasionally, a particular urinary infection can tint the urine greenish, usually along with a strong odor, burning, and fever. If you ever see that combination, it's one for the doctor and the proper antibiotics. Please don't try to treat that one yourself. And now I come to the most serious color on today's list. Brown or very nearly black, like cola or strong black coffee. This is one to act on right away, not tomorrow morning. One cause is serious liver trouble, usually alongside a clear yellowing of the skin, deep fatigue, and a loss of appetite. But there's another cause, less well known, that I want you to know about. When muscle tissue breaks down from extreme overexertion, a bad injury, or certain conditions, it releases a substance into the blood that turns the urine dark, and it can strain the kidneys badly within just a few hours. So if you ever see cola-colored urine together with muscle pain, weakness, and exhaustion, please treat that as an emergency. Get medical help straight away. Don't wait for morning. And now the one so many people ignore, yet it carries some of the most important information of all: cloudy urine. Normal urine is clear or softly pale. When it turns cloudy, like faint rice water or a little milky, it's worth understanding why. Often it's simply dehydration. Drink some water and it clears within a visit or two. Sometimes it's a urinary infection, cloudy with a stronger smell, burning, and that urge to go again and again. Sometimes it's kidney stones. But here's the one I most want you to hold on to. Foamy urine. Lots of little bubbles that are slow to pop, like soapy water swirling in the bowl, can mean protein is slipping through where it shouldn't. And that is one of the earliest, quietest signs of kidney trouble. Kidney disease is a silent thing. It can go on for years with no clear symptom at all until a great deal of quiet damage is already done. So if you notice your urine is foamy morning after morning with bubbles that linger and linger, that is well worth a simple urine test. Catching it early truly makes all the difference in the world. Now, it isn't only color that carries a message. The smell does too. Normal urine has only a mild odor. First thing in the morning or when you're a little dry, it's natural for it to smell stronger. That's just concentration, and a glass of water usually settles it. Certain foods change it as well. Asparagus is the famous one, and that distinctive smell afterward is completely harmless. But a couple of things are worth a gentle mention to your doctor. A strong, foul odor, together with burning or urgency, can point to an infection. And a smell that turns persistently sweet or fruity is one to bring up too, because it can sometimes relate to blood sugar. As always, I'm not asking you to worry, only to notice and to mention what you notice. And then there's the simple question of how often. Now, all of us are a little different, but if you find yourself going far more often than usual, or getting up several times in the night when you never used to, that's worth paying attention to. Waking once in the night is common enough as we age, but waking 3, 4, 5 times, night after night, will wear you right out, and it deserves a conversation with your doctor. Here's a gentle habit that helps many women. Enjoy most of your fluids earlier in the day and ease off in the last hour or two before bed, while still getting plenty overall. And if a medication seems to send you to the bathroom more, please never stop it on your own. Simply ask your doctor whether the timing might be adjusted. Now let me tell you about someone. Years ago, I cared for a woman. I'll call her Eleanor, a bright, no-nonsense lady in her late 60s. One morning she mentioned, almost in passing, that her urine had looked a little pink a couple of times. But she'd felt perfectly fine, so she'd very nearly said nothing at all. I am so glad she did. She had no pain, no fever, nothing that would have made her hurry in. We simply arranged a test, the quick, painless kind. Now, I would never tell you that noticing a color is a diagnosis of anything. It isn't, and it never is. But Eleanor taught me something I've carried ever since. The women who do well are so often the ones who notice the small thing and don't talk themselves out of mentioning it. You know your own body better than anyone on this earth. Please, trust it enough to speak up. Let me gather all of this into something easy to hold on to. Clear as water, you may be overdoing it. Ease off and watch. Pale yellow, wonderful. You're well and hydrated. Bright neon yellow, almost always just your vitamins. Dark yellow, drink more. And if it lasts or comes with yellow skin, check with your doctor. Pink or red, think of food first. If it's not food, see your doctor that day. Orange, usually food or medicine, but with yellow skin, get seen. Blue or green, usually harmless, but with odor and burning, get checked. Brown or black, go now, don't wait. And cloudy or foamy, drink water and watch. But if it lingers past a couple of days, get a urine test. Before we finish, let me leave you with 4 simple habits, gentle, free, and truly worth it. First, Drink the right way, not just a great deal all at once. Aim for around 6 to 8 glasses across the whole day. And remember that soups, tea, and juicy fruit all count too. Start with a glass first thing in the morning, after that long night without water. Then sip steadily. Don't wait for thirst to remind you. Second, fill your plate with vegetables and fruit. They give you water, they give you potassium that helps your kidneys do their work, and they offer gentle protection to your kidneys and liver over time. And go a little easier on the things that don't truly count as water. Fizzy soda, very strong coffee cup after cup, and alcohol. They can't replace plain water, and they ask more of your kidneys, not less. Third, and this is my very favorite, each morning take just 3 seconds to look and to listen to your body. What color? Clear? Cloudy? Any bubbles? Anything unusual? It costs nothing at all, and it takes no time from your day. Yet it can help you notice a small change long before it ever becomes a big one. And fourth, know your own normal. Every body is a little different. Your usual color, your usual rhythm, your usual self. When you know what's normal for you, you'll spot a true change all the sooner. That quiet awareness is a kind of everyday medicine all its own. And if a change lasts more than 2 days for no clear reason, or comes with pain, fever, or unusual tiredness, that is the time to see your doctor for a simple urine test. It's quick, it's painless, and it isn't expensive. Our bodies are never truly silent. They speak to us every single day. We only have to learn how to listen. And my greatest hope is that after today, you'll begin that little 3-second habit each morning and slowly come to understand what your body has been quietly telling you all along. Take good care of yourself. You've earned it. And remember, always check with your own doctor about anything that doesn't seem right. This is Nurse Carol, wishing you health and peace. I'll see you next time.